You are listening to the Body Charge podcast, and I'm your host, Sandy Sanderson. Welcome to the Body Charge podcast. Today's topic is how can disc decompression therapy alleviate chronic back pain? Rather than masking ongoing pain with medications and no end in sight, why not look at what is causing the issue and fix it? My special guest today is Dr. William Moyal, a chiropractor and certified chiropractic sports physician based in Florida with over 39 years of clinical experience. He's developed a three-step system in non-surgical treatments for chronic back pain, and his work has been featured on major platforms such as CNN, HGTV, Fox News, NBC Sports Network, and in publications like the Miami Herald and Sentinel. He's also an 18-time author and has been recognized as one of America's best spinal decompression physicians. So welcome aboard, Dr. Moyal. Lovely to have you on the Body Charge podcast.
Thank you for having me. It's a pleasure.
So this is a big problem these days. A lot of people are experiencing back pain for various reasons. What are the typical kind of issues that cause back pain and the different types that you see?
Well, there are several different types. If we go back a little bit statistically, and because over the last 40 years, actually, I've seen patients from 122 countries, I can tell you that it's universal. It's about 85% of the population will have back problem or spinal problem at some time in their life. And the biggest causes are joint dysfunction, muscular atrophy or weakness, and also disc issues. And so where most traditional treatment goes to treat the pain and to get rid of pain, we have to understand that if you didn't have a problem, you wouldn't have pain. The reason you have pain is because you have a problem. So instead of just treating that and masking that, to me, it's more logical to figure out what the exact problem is so that we get a more permanent solution to that issue instead of constantly masking it, taking more drugs, then those drugs don't work, and you take something stronger, and next thing you know, you're addicted to 10, 15, 20 different medications, or have tried so many different approaches that never really got you any kind of results.
Let's talk a little bit about the dangers of this chronic medication, such as, opioids and oxycodone. And, there are a lot of medications which are very dangerous to health taken on the long term, may be okay for a short-term crisis, but definitely not to continue being taken. But then people develop almost, they get used to it, don't they? Then they need more and more. So what kind of issues do you see as far as the medications go?
Well, exactly what you said. They get used to it. And especially in the United States, for example, according to Mayo Clinic, people in their 40s are already on 4 or 5 medications. People in their 60s are about 15 medications. People in their 80s are on 18 plus medications. Now,
Cascade, isn't it?
It's very scary. And the other fact is that the United States is 5% of the population of the world, yet, according to Mayo, 75% of all medication is taken here in the United States. So 95% of the world only takes 25% of medications. 5% of the world takes 75 because, especially here again in the States, I hate to say it that way, but everybody wants a quick fix. It took time.
They mask the problem thinking it's fixed, but it's not really fixed. So when the problem is still seething underneath that numbing thing that they've taken.
Correct.
It's still deteriorating or getting worse.
100%.
And as you said, the body's pain signal is a cry for help, that something needs to be fixed, something's wrong. And so if we keep taking drugs to mask, it's not fixing the problem. And the long-term effects of that drug taking is you're hurting your liver, right?
Oh, your liver, your kidneys, stomach, all
organs.
kinds of things.
Yeah.
And then they're going to want to take more drugs to try to correct those things instead of really flushing out the poisons and getting cleaned. Um, I mean, if you think about drug addicts, the best and unfortunately the most painful way for them to get clean is to go into a rehab and detox.
Yeah, because it's
Not pleasant,
yeah, no,
you
very
know,
difficult. Yeah.
and
Yeah, so there's a cascade of events, isn't it? So people may have a back pain for whatever reason, an injury or posture or something that's maybe put a disc out. The pain then um, leads to, oh no, I can't go to the gym, I can't do my exercising, I can't keep my muscles intact. So then they start to get muscle atrophy, don't they? And then
yes,
that leads to a further cascade of problems. Can you describe
correct.
all the things that happen in that chain reaction?
Well, basically, the end result is weakness. And it's just like when someone breaks an arm, they go into a cast. Well, by the time the cast comes off after 2, 3 months, there's atrophy of the muscles. And that arm is going to be skinny compared to the opposite side. And so when the body is not challenged to work, it actually stops working. It doesn't hold its load like it's supposed to. And then it creates a compensation mechanism that the rest of the body has to deal with. And that creates more patterns, and it's a vicious cycle. And so, again, most of the time when people are in pain, they want a quick fix, they want a pain med, they want to reach for something to make the pain go away instead of really understanding what is causing the pain. How do I really get rid of this and understand what the exact problem is? And very commonly here, and I'm sure it's not just in the States, but all over the world, if someone goes to the emergency room, most of the time they're not even x-rayed, they're not really worked up properly. They have a pain. Oh, let me give you this for your shoulder pain or for your back pain or for your knee pain.
Quick fix,
And just a quick fix. And
but
so
it's not really.
sometimes the pain goes away and the
Mm,
person thinks, oh, the pain's gone. Everything's back to perfect.
mm.
And that's not the case at all. And many years ago, I used to deal with a lot of professional bodybuilders. And when they would come in or I would meet them at the gym, I would do a couple tests and show them that they were actually very weak. And which is the last thing that they want to hear when they're building all these big muscles. But then it took me quite a few years to figure out one question. How do you feel when you don't go to the gym? Oh, I'm in pain. I can't wait to go back. And then I would say, that tells me you're injured. Well, what do you mean? Well, when you work out, you release endorphins, kills the pain. When you're not working out, now your body has time to assess all the different injuries and then tries to go to fix it. So you're going to have pain, maybe inflammation, restriction of motion, and difficulty even getting out of bed.
Yeah,
And so,
because when you're exercising, your brain produces endorphins, doesn't it, to kind of numb the
yes,
pain. You produce your own painkillers.
correct. And that's why even like runners, as they call the runner's high, they want that feeling of euphoria. And, but they don't realize that they're actually causing damage.
Even
They just
more
don't feel it.
friction and yeah, irritation. Because if
Misalignments.
something is compressed, so in the disc, so that's very important for the nervous system. Nervous system connects to every part of the body. It's your central highway, right? So if you
Correct.
have disc compression, it's pushing on the nerves, which means the signals and the messaging in the body is not working the way it should, right? Is that the way to describe
Correct.
it?
And not only that, the purpose of the disc is to separate the vertebrae so that there's motion ability to go
Yeah,
in
like
flexion,
shock absorbers.
extension. And so when that disc gets damaged, gets thinner, the bones approximate, they don't have that same movement. Kind of like if the door is not hung properly, it's going to be harder to open it or close it because things are touching when they shouldn't be touching.
Yeah.
And
So
so the long term
yeah.
effect is degenerative changes in premature arthritis.
degenerative changes because of the constant friction and irritation of something grinding, that
Correct.
the body moves calcium into that space because
Correct.
calcium is attracted to sites of acidity, which comes from excessive inflammation that causes an
Correct.
acid environment. Then the calcium moves in as an alkalizer, but then it gets stuck and starts to harden that place of injury. So, in disc decompression, which is your specialty, what kind of things can you and do you do for people to help fix the problem?
Well, that's a great question. Spinal decompression has the ability to re-engage the disc. So it's like going to the gym, and if you work out, you're going to build the muscles, whether it's your arms or your legs, because as you demand of the body supplies it, makes the changes, breaking down tissues and then rebuilding them. And so the disc, in order to be healthy, needs to be able to move under compression, then rebound. Okay? Kind of like if you take a sponge, squish it. If it's a good sponge, it's going to come back when you release the pressure. Now, the other thing that the disc needs is water, oxygen, food, okay, or nutrition,
People don't
blood
drink
supply,
enough these days, not enough water, not
correct,
enough hydration.
or too much soda.
Mm.
And it also, which a lot of times people forget, you need to flush out the disc. You need to get rid of the waste products. Otherwise, they accumulate and breaks down the tissues even further.
Because of
And
the
so,
acids. Yep.
correct. And also the lack of motion or movement of fluids in and out.
Well, the movement creates that squeezing, doesn't it? So we,
Yes.
without moving, and the lymph especially, that's our waste
Yep.
disposal system, can't remove those wastes from the tissue cells.
Correct.
We're squeezing, expanding, and contracting.
Correct. And that creates what we call a disc pump mechanism. So
Pump.
as the pump moves, things go in and out like it's supposed to. When the disc is damaged, that pump mechanism reduces, is not as efficient. Therefore, those tissues break down further.
So
Now,
we're
the
pumping
beautiful,
less when there's pain and inflammation because it's like swollen and it hurts, and you just want to keep still and not move anything.
correct, you move less. So the beauty of spinal decompression is it actually re-engages that pump mechanism, causing fluid, oxygen, nutrition, water, blood supply to get in, also pushing out waste products. And because the disc is made of cells, just like, whether you're shaving your legs or I'm shaving my face, if I cut myself, I know in 3, 4 days it's going to heal. And so, because the disc is made of cells, those cells have the ability to take that water, that nutrition, that oxygenation, the blood supply, and heal. And so, it actually can regain height and firm up even more, just like the broken arm in the cast can heal, the disc can also heal. Now, that's a different concept than when I went to school, which we were taught the only two solutions. Eventually, there'll be so much damage that the bones will get so close together they'll fuse,
Yeah.
or you need surgery.
Surgery to
And
scrape it out, right?
correct. And now we now know, and there are tons of research papers that shows that the disc can heal and can repair itself.
Well, that's encouraging. That's encouraging because my own mother had that spinal surgery um, to remove the calcium of the fusion.
Hmm.
And because she had been leaning over quite a lot, and then she was able to stand up, and we thought, oh, well, that's successful. But then it caused a whole lot of other cascading downstream problems for her central nervous system, and that she actually got nerve damage from that operation. So
Sure.
she eventually lost the use of her legs.
Oof.
Yeah.
I'm so sorry to hear that.
Was
Yeah.
that was
And
the beginning of the end because she was mortified at having a disability because she was used to being active, and um for her it was humiliating, and
yes.
I think she willed herself to die.
Yeah. And
So it's a horrible thing
it,
to lose your
mm,
capacity, and now we have information which can treat things in a gentler way and help the body to regenerate, which is really encouraging. I mean, we, you know, don't just reach for the
absolutely.
apple.
Yeah. And a lot of it can also be done through nutrition and choosing the proper foods that do not cause so much acidity.
That's
So,
true. That's true. I was thinking while you were talking before about the hydration and how the discs can, how they need more hydration. And one thing that helps pull the water in is extra magnesium because it
yes,
has a very strong relationship with water. In fact, the body rejects empty water without the electrolytes. It's the presence of magnesium that helps the tissue cells suck up more water
correct.
and hydrate better.
Yeah.
So
That's why we in the office also give our patients Himalayan salt
yeah.
because of the amount of minerals that are in there. And I tell them, look, use as much as you want because it's not like the typical white salt, sodium chloride, that can really affect your blood pressure and everything else. With this, you're actually feeding your system minerals.
Lots of trace minerals, yeah. But it's still low in magnesium, 3.5%. So I would recommend both because we
Yes.
need like a little bit of everything. And magnesium's the one you lose under stress. And I've seen many people dealing with stress, and even in my own family, the stress of pain. Pain itself is extremely stressful. So
Yes.
just dealing with pain causes people to lose excessive magnesium in the urine. We just churn through a lot of it through the pain. And then that low magnesium status increases inflammation in the body because the body doesn't have enough resources to get the job done, to get over the
Right.
line. So the inflammation can become chronic.
Yep. Can also affect their sleep pattern. And if you
Mhm.
don't sleep, you're not going to heal very well because your body needs downtime to rebuild itself and reboot itself as well. So,
Yeah,
oh,
reset, reboot, and reset.
exactly.
So
Exactly.
in your is it three-step process? You have a
Mhm.
program which has proven to be very successful. Can you
Yes.
describe what happens in that program?
Yeah, it's actually very simple. The first thing is we need to discover what is going on. Not just, oh, you have shoulder pain or neck pain or back pain. Let me give you some to make the pain go away. I want to know, why do you have that? Because if we never answer why, we're never going to get a permanent resolution to the problem. And maybe it's something they're doing. For example, computers. Most people are on the computer quite a few hours a day.
Yep.
And if you listen to Dr. Google, it will tell you that the top of the computer should be even with your eyes, which is so far from the truth
Yeah.
because other studies show that 70% of the work we do when we're really working is on the lower two-thirds of the monitor.
Mm.
So ideally, you want the monitor, the top of it, to be much higher so that when you really engage, your eyes are centered with the monitor. That can get rid of a lot of shoulder and neck and lower
Yeah.
back stresses.
Yeah, because people end up otherwise being hunched over, don't they?
Correct.
And
And
then
then they
there's
get into
also
the
having the right kind of chair that,
absolutely.
and
And
what about
sitting,
standing up at the computer? Do you like that strategy?
I do. I do. I like to do both. In the office, I have a standing desk that also goes to a normal height, but I like both because it gives you a break, you know?
Yeah, just move. Yeah, you can have a rest and then change and move around and
Well, and the other thing too is to take a break from the computer from time to time. Go walk around.
yeah,
You know,
have a drink of water with
have a
minerals.
drink of water. Yes. I actually wrote a book on that, and it really boils down to it's a very simple formula, which is take your body weight, divide it in half. If you're not a big gym person, you can add 20%, and those are in ounces. Okay. So, whatever that number is, that's how much you should be drinking per day. Now, most people are nowhere near that. So, I tell them, look, start off slow and build to that because otherwise, you might as well move into the restroom because that's where you'll be all day.
Yeah, so
So,
the people get used to being dehydrated. The body just adapts, and then you lose your thirst mechanism. So your thirst
correct.
mechanism isn't working. And you can be dehydrated but not thirsty to drink. So you
Right.
have to kind of change your habit and routine, don't you? And
Right.
like make yourself drink a little bit more. But you know, when people are drinking the wrong kind of water, it's filtered, it's empty, it
Hmm.
doesn't taste very nice. It's, you know, you gag very quickly when you drink it in.
Yep.
But when the minerals are present, the water takes on a different charge and it tastes really velvety and smooth, and you can drink more water without gagging. And it's very pleasant. You really
Yes.
want to, and you crave to drink the good water.
Yes. And that's one of the things too is, as we get, I hate using the word older, but as we get younger, um, there's certain mechanisms that within the body, because hormone levels drop, all kinds of other things, the thirst mechanism also tends to lower. And then people start having constipation and digestive problem. And instead of understanding you need more water to flush things out, they don't. They'll take a more coffee or more tea,
Which
which dehydrates
dehydrates you.
them
Yeah.
even further.
And sodas too. Everything pulls more water out than it donates.
Sure, sure. Especially sodas and the darker sodas with the phosphoric acid can actually damage the bones
Yes.
and pull the calcium out. So there are
Yeah.
a lot of things that, because I guess monetarily, financially, they get promoted. People have a tendency to go towards the promoted items, but they don't realize that it actually does a lot of damage to their system. And later on, as they get older and it starts to really manifest, now they'll do anything and everything to try to fix it. But sometimes you go beyond what the body can fix. And so you end up succumbing to surgeries or medications and things like that that should have been avoided to begin with.
Yep. Yep. There is a point of no return at some stage.
Correct.
But if we can catch it early, it's always the best. And the body has its own wisdom, given the right ingredients, the right environment, the right input of resources. It has the opportunity to do its own healing without the negative side effects, without the scar tissue or the damage or the, you fix one thing, but you cause a bigger problem. We have to try and get rid of that mentality, don't we, to cut, burn, and poison at any opportunity. I
Well, I
mean,
mean,
obviously, as a last resort, keep it up your sleeve, but it shouldn't be the first port of call.
no, and it's really a very simple thing. If we think of the body like a machine or like a car, what does a car need? It needs a battery, it needs water, it needs oil, it needs gasoline, and it needs air in the tires. So when we understand that and we maintain that, the car is more likely going to drive pretty well.
And
If we abuse it,
you can't leave it sitting there for long
no,
periods of time without charging it with the battery, because then the battery goes dead.
yes, or the engine might freeze.
Yeah.
And then you have other issues. Or on the other side, if you abuse the car, it needs more maintenance. And the body is basically the same. It's made of parts. Parts can break down, but they're less likely to break down if you honor the system, honor your body,
Yep.
don't pollute it. You exercise, you get massages, you get spinal adjustments to make sure that the structures are working properly. You clear your mind,
Yeah.
maybe go get some sun, go to the beach, go do something you enjoy doing so that the body has a nice balance of everything.
It's all about the balance, isn't it? And getting enough energy to to support all of the functions and all of the systems. It's about, at the end of the day, energy generation.
Yes.
So supporting the body's energy supports the nervous system, the bones, the muscles, the movement of everything. We are a bunch of moving parts, different
Hmm.
to a car in that we can generate our own new tissue cells,
Correct.
as a car can't. However, it's a good analogy, nevertheless, that both need maintenance to maintain balance and
Correct.
optimal energy, because
Yes.
We need that car to be able to start and the engine go well and get from A to B and the steering works and the tires work. We need everything working and well maintained. So that's a good analogy with the body. But people don't give the body enough attention usually, do they? It's like you can do anything you like. I guess when you're 21, you can abuse yourself a lot more, but you learn
And
some
it
lessons.
comes back to get you later.
Bites you.
Yeah, it does. And you're right. It's very much like the body, or like the car. But what's special about us as humans is that we have an innate intelligence that allows us to function, survive, protect, and heal. And when you have that working, you have a better life and a better ability to perform at a higher function versus, oh, I have pain. Let me take whatever pills or potions to try to make it go away without ever understanding why you have it. Maybe headaches, maybe you're not sleeping enough. Maybe you're not drinking enough water.
Yeah.
Maybe you're too much in front of the computer.
All the basics. Now we
All
need
the
to
basics.
really have a self-audit, don't we?
Yes.
To help people with their self-audit, it probably would help if they read something of what you've written or connect with you. Where should they go to find out more?
They can go right to my website, or yeah, the website probably easier to describe. It's Coral Way, CORALWAY, disc, DISC, and then center, spelled differently than you do back home, CENTER @gmail.com. So Coraway Disc Center @gmail.com. They can also access me at Linktree, if you're familiar, LINKTR /EE/ Dr. Moyal, DRMOYAL. And that'll give them all kinds of information.
Fantastic. We'll also put it in the description under the video.
Thank you. Awesome. Thank you so
Well,
much.
thank you too for sharing your wonderful wisdom and experience. I'm sure people will get a lot out of it. It's all about self-care and good maintenance so we can
Yes.
live long, well, and healthy. I mean, we don't necessarily have to get disease. We can just one day, just fall asleep and not wake up and not have a lot of drama in the
Yeah.
death process, right?
Well, it's kind of like a candle. You burn both ends until it finally flickers out and goes. It's time. But
Yes,
that's the way life should be, being able to be
quality.
bright and
That's
yes,
it. The quality of the energy and the quality of life needs to be front and center of all our attention. It's not about living longer but badly. It's about living well the whole time.
yes, absolutely. I
Thank
don't
you
think I
so
could have
much.
said it better.
Yeah. Thank you so much, Dr. William. You have a good day.
Thank you. You too.
Bye-bye.
Bye-bye.
I hope you liked this conversation and will share it with others. Let me know what you thought about it in the comments below. If you want to listen to other Body Charge conversations, click like, subscribe, the bell icon, and click all notifications. Subscribe to our newsletter to get updates on blogs, podcasts, videos, and magnesium special offers at electromagnesium.com.au. Relax, recharge, and recover.